1 in 8 men will be diagnosed with prostate cancer in their lifetime. But here's what most don't realize. The disease gives you warning signs months before it shows up on a scan. 5 specific symptoms that appear early. Most men ignore them. And by the time they walk into my office, we're dealing with advanced disease. Today I'm showing you exactly what to watch for, and what to do if you notice any of these signs. I'm Dr. Max, practicing urologist with 15 years of clinical experience. I've diagnosed hundreds of prostate cancer cases, and the pattern is always the same. Men ignore subtle changes in their body. I want to give you something that can make a real difference starting today. I have created a complete guide for you. 5 simple steps to boost your sexual health. This is not theory. These are practical, science-backed actions you can implement immediately. Inside this guide, you will discover the exact protocols I use with my patients, how to optimize your testosterone naturally, what actually reduces stress and restores function, the specific foods and exercises that support hormonal balance and blood flow. Everything is clear, specific, and proven. Go to the link in the description right now and get your free checklist. Take action today. Your confidence and health are worth it. They wait. They hope it goes away. Meanwhile, the cancer progresses from stage 1 to stage 3. Early detection gives you a 98% survival rate. Late detection drops that number significantly. So let's talk about the 5 warning signs you cannot afford to miss. Here's what you need to understand about prostate cancer. Unlike other cancers, it often grows slowly. You can have cancer cells in your prostate for years without feeling anything wrong. This sounds good, but it's actually dangerous. Because by the time symptoms appear, the tumor has grown large enough to press on surrounding structures. Or worse, it has spread beyond the prostate capsule. I had a patient last month, Robert, 56 years old, successful business owner. He noticed blood in his urine 6 months ago. Just once. He thought it was nothing, maybe a urinary tract infection. It went away, so he ignored it. Then it came back. Then he started having trouble urinating. When he finally came to see me, we found stage 3 prostate cancer. If he had acted on that first warning sign, we would have caught it at stage 1. His treatment would have been simpler. His prognosis would have been better. Don't be Robert. Know these 5 warning signs and act on them immediately. Let's start with warning sign number 5. Waking up multiple times at night to urinate, more than twice per night. We call this nocturia in medical terms. Now, an enlarged prostate causes this too, and that's much more common than cancer. But here's the key difference. With benign enlargement, the pattern is gradual, slowly worsening over years. With cancer, the change is often more sudden. You go from once a night to 4 times a night within a few months. Why does this happen? The prostate surrounds your urethra like a donut. When cancer causes the gland to enlarge rapidly, it compresses the urethra. Your bladder can't empty completely, so it fills up faster, and you're back in the bathroom 2 hours later. A 2023 Johns Hopkins study tracked 847 men with new-onset nocturia. 18% had undiagnosed prostate cancer. The men who got checked early had significantly better outcomes. If you're suddenly waking up multiple times per night, don't assume it's just aging. Get a prostate exam. Now let's move to warning sign number 4. Your urine stream. It used to be strong. Now it's weak. Or it stops and starts. Or you have to strain to get it going. This happens when a tumor blocks the urethra partially. Think of it like a kinked garden hose. The water pressure drops. The flow becomes irregular. Here's what concerns me in practice. Most men adapt to this. They just allow more time to urinate. They don't mention it to their doctor. Meanwhile, the obstruction is getting worse, and the cancer is growing. Stanford researchers found that men with sudden onset weak stream have a 12% higher likelihood of prostate cancer compared to men with gradual weakening over 10 years. The speed of change matters. If your stream has weakened noticeably in the past 6 months, this deserves evaluation. A simple PSA test and digital rectal exam can tell us what's going on. Warning sign number 3 is something you definitely cannot ignore. Blood in your urine or semen. Seeing blood where it shouldn't be is always a red flag. In urine, we call it hematuria. In semen, it's hematospermia. Both can indicate prostate cancer, especially if they occur repeatedly. Here's the medical reason. Prostate tumors are highly vascular. They form new blood vessels to feed their growth. These vessels are fragile. They can bleed spontaneously, or they bleed during ejaculation when the prostate contracts. Now, other conditions cause blood in urine too. Kidney stones, infections, trauma. But here's what you need to know. Visible blood is never normal. Whether it's from cancer or something else, it requires immediate medical workup. A Mayo Clinic analysis found that men over 50 with unexplained hematuria have a 15% chance of having prostate or bladder cancer. That's high enough to warrant urgent evaluation. Don't wait to see if it happens again. One episode of blood is enough to get checked. The second warning sign is pain. Persistent pain in your lower back, hips, or pelvis. Deep, aching pain that doesn't go away. It's not muscle soreness from exercise. It's not arthritis that comes and goes. It's constant, and it's getting worse over weeks or months. This indicates advanced prostate cancer that has spread to bones. Prostate cancer has an affinity for bone tissue. When it metastasizes, it goes to the spine, pelvis, and femur first. The cancer cells disrupt normal bone metabolism. They cause inflammation, and they weaken the bone structure. This is the warning sign I hate seeing, because it means we're dealing with stage 4 disease. Treatment becomes about management, not cure. But even at this stage, knowing sooner rather than later makes a massive difference in quality of life. A European study followed men with late-stage diagnosis. Those who sought treatment within 2 weeks of bone pain starting lived significantly longer than those who waited months. Pain is your body screaming for attention. Listen to it. If you have unexplained bone pain lasting more than 2 weeks, especially if you're over 50, get imaging done immediately. And now we get to the number one warning sign that catches most men completely off guard. Sudden erectile dysfunction when nothing else has changed in your life. You don't have diabetes. You don't have heart disease. No obvious risk factors. But suddenly you're having trouble getting or maintaining an erection. And here's what happens. Most guys blame stress. They blame work pressure. They blame relationship issues. Sometimes that's the cause. But sometimes it's your prostate sending a warning signal. Let me explain the medical connection. The nerves that control erections run right along the prostate capsule. When a tumor grows, it can compress or invade these nerve bundles. The result? Difficulty with erections. And because this happens gradually, men don't connect it to cancer. They think it's just part of getting older. But research from the University of California followed men who developed ED before age 55 with no other risk factors. 22% had prostate abnormalities on imaging. 8% had cancer. Now listen, I'm not saying every case of erectile dysfunction is cancer. That would be wrong and cause unnecessary panic. But if you're experiencing new onset ED, especially combined with any of the other 4 warning signs we just covered, you need a full urological workup. PSA test, digital rectal exam, possibly an MRI. Here's what I want you to take away from this video. Prostate cancer is one of the most survivable cancers when caught early, but you have to know what to look for, and you have to act when you notice changes. These 5 warning signs are your body's alarm system. Frequent nighttime urination, weak urine stream, blood in urine or semen, persistent bone pain, unexplained erectile dysfunction. Any one of these deserves medical evaluation. 2 or more together demands immediate action. The biggest mistake I see is men waiting to see if symptoms go away. They don't. They get worse. And the window for easy treatment closes. So here's what to do today. First, schedule a prostate exam if you're over 50, or over 45 if you have family history of prostate cancer. Don't put this off another month. Second, start tracking urinary symptoms. How many times you wake up at night? Stream strength. Any blood. Write it down. This information helps your doctor make accurate decisions. Third, talk to your doctor about PSA testing. It's a simple blood test that can detect problems before symptoms even appear. If you found this video helpful, subscribe to this channel for evidence-based men's health from a practicing urologist. Next, watch my video on natural ways to support prostate health. It covers the foods and supplements that research shows can reduce prostate cancer risk. Remember, these warning signs don't guarantee cancer, but they do guarantee you need evaluation. Early action saves lives. Take control of your health today.